So we'll move more back to some of the science work, and Dr. Eagan is our next speaker. Dr. Eagan is an internal medicine resident at Southeastern Regional Medical Center in North Carolina. She's also, interestingly enough, a licensed registered dietitian, so this is just great and the perfect intersection. She's interested in how nutrition actually can impact overall health. And if you ever see me in clinic, my answer to diet is I don't know, which is not a good answer, honestly. And she'll probably explain a lot more, but she also has a very interesting this disease that few clinicians have, but I'll let her explain more. Thank you, Dr. Eagan.
All right. Thanks, Dr. Lambert. As Dr. Lambert said, I am, well, we got the wrong presentation up here. One second. I'm Dr. Eagan. I am second-year resident in North Carolina. I have 5 days left, then I'll be a third year. Ultimate goal is actually to be endocrinologist with my dietitian background. So I'm currently working on applying for that. But since we're waiting for these to come up, before I got into medical school in Houston when I was doing my dietetic internship. And one of the requirements is, you need to go to a doctor and get a physical. So I chose out of hundreds of doctors. I'm from Indiana originally. A doctor. And she's like, oh, okay, well, you want to get any blood work? And I'm like, sure, whatever. At the time, I'm on my parents' insurance. So I got it. I get a call the next day when I'm working. You need to get in here right now. You got some form of hepatitis. Your liver enzymes are over 1,000. I'm like, I have what? And so I go in there. The next day, got redrawn. There we go. Same thing again. So I was actually diagnosed with autoimmune hepatitis before starting med school. All right. So it's coming, maybe. Two minutes, he says. So, I know there's a lot of discussion on the Facebook page. I am on there, DMERD, which you'll see at the end of the presentation. I was here at the first conference, but I was not speaking. Kathleen Hansen did, and she's a dietitian too. If you want to refer back to her presentation, she went over the amounts of each nutrient that you need to take in, and I didn't really go into that detail since that's already available for you on YouTube. I'm going more over science-based things, and then advice I give for weight loss, weight gain, prednisone, some other medications we take here, side effects, and how you can try to combat those. I would take questions now, but
Danielle, you can go ahead and start. It'll be a few minutes still.
All right. So I guess good thing I memorized my presentation to some extent. So I was going to say I have no disclosures to report, and before you take any of this advice I give today, make sure you do talk with your doctor about it. We have to give that disclosure. So today we're going to talk about, I hope you learn, what foods are ones you should look at, what side effects and medications, why you should avoid taking any supplements. And I just hope you have a better understanding of when you see on that Facebook page, you can buy this book, you can follow this diet, and now you're cured, you can take no medicine. I mean, there's one instance, which I actually will talk about, where that may work, the diet. But otherwise, it's not a reality. Basically, the nutrition part of this is to optimize your health to help your autoimmune hepatitis to be the best it can be with what we have. So everywhere you look, there's another diet you see. Gluten-free, fat-free, paleo diet, anti-inflammatory. It's all about eat this, not that. What are you supposed to do? So as you can imagine, research And autoimmune hepatitis is limited in nutrition. Doesn't that surprise anyone here? I don't see anyone. So the first thing we're going to talk about, about coffee. Now, coffee has not been specifically studied in autoimmune hepatitis, but it has been studied in other things like hepatitis C. And they have found, there's a study that showed over 20,000 people, and those that drank 2 to 4 cups of coffee had lower liver enzymes and less fibrosis on liver biopsy. Now, the thing with that, some studies tested decaf coffee, some tested regular coffee, and both things were seen both ways. I know somebody mentioned earlier, osteoporosis is a side effect of some of the steroids, and caffeine can lead to the osteoporosis. So I'm not going to say don't drink regular coffee. I'm going to say, maybe do some of both. That way you don't get one of too much of the caffeine. Next thing is fatty liver disease. I know we talked about that earlier. The research on that shows that those with fatty liver disease have a harder time controlling their autoimmune hepatitis. And some of that is, I have a slide that shows, liver biopsy, which we've seen already today anyways. And what happens is when you have those fat globules in the liver, it's taking up space where normal cells should be. So if you're already having autoimmune hepatitis, so you're having the damage from that, and now you have the fat cells taking over maybe what little one you'd have left. Now you have, your autoimmune hepatitis is going to be harder to control. How do you get fatty liver? Well, one of the most common ways people get it, if you're overweight, you can get it. If you have diabetes and your blood sugar's out of control, you can get it. So how do you combat that? You try to lose weight. You want to get to your ideal body weight. And in a male, that would be this is in American units. For a male, if you're 5 feet, you start with 106 pounds, and then for every inch over 5 feet, you add 6 pounds. If you're female, you start with 100 pounds at 5 feet, and every inch over that, you add 5 pounds. So if you're 5'5", then you should be 125 pounds. 100 for being 5 feet, and then for 5 inches, 5 times 5 is 25, 125 pounds. So doing a slow diet and exercise program, that is a lifestyle change. That's the key. Lifestyle change is what you want to do. If you're doing these diets, that you are going to do for a week or a month, and then you're going to go off of it, then you're going to cause more harm than good. Vitamin D, and these are probably a little bit out of order. Vitamin D, as Dr. Lambert had mentioned earlier, has been shown that those with worse vitamin D actually have more autoimmune hepatitis worse off than if it's in a good range. Good range is 30 to 100. Also been shown on liver biopsy, if you have a lower vitamin D, then you have more fibrosis. Here we go. Let me click through some of this real quick. So here's all these different diets out here. He's got my old one, but that would work. So here's what I was talking about. So next one would be gluten. Do you need to follow the gluten-free diet? This slide's actually near and dear to my heart. I had a couple images, but I think it's all right. They have the old one up here. So when I was in Houston and was diagnosed with autoimmune hepatitis, I'm like, how could I have 4 autoimmune diseases diagnosed in the last 5 years? I didn't know what was going on. So I started doing research and found out that there were some studies out there that said if you had celiac disease and it wasn't treated, then over time, it could lead to other autoimmune diseases. Celiac disease is an autoimmune disease of the small intestines. You eat gluten, which is found in wheat, barley, and rye. And what that does is it sets off your immune system and causes you can have diarrhea, you can have anemia, you can lose weight because you can't absorb things. And then they're thinking that there's the leaky gut syndrome, gets out in the blood and then sets off other problems. So there was a study done, and I don't think it's not on here. There was a study done, and it showed, those that were tested for celiac disease early in their life and followed the gluten-free diet had less autoimmune diseases than those that later on were diagnosed later at a later age. If you were diagnosed at less than 2, you had like a 5% chance of having another autoimmune disease. I think it said if you were diagnosed at 30, then you had a 35% chance of another autoimmune disease. So here's what I'll say. This is probably the only way that I know of, at least, where it's a possibility that you could cure your autoimmune hepatitis if you followed this diet and you had celiac disease. If you don't have celiac disease, then there's no reason really to eliminate gluten unless you have an allergy to it or something. Otherwise, it's not going to do much. First, what they usually do is a blood test that checks to see if you may have it. The definite diagnosis is an endoscopy. They do a scope down to your intestine, take a biopsy, and see, if the intestine's flattened, then that means you have the disease. So you can ask your doctors, when you go home, have I been tested for this, just so you know. So I know this is a hot topic on the Facebook page, Autoimmune Paleo Diet. Everyone wants to know if this does anything. So here's the deal with this. So the paleo diet, already eliminates a bunch of things. The thought about this diet was, the ancestors going back, you should just eat like a caveman and all your problems will be solved. And it only goes to a certain period. So if some food was found after that period, even if it's a healthier food, it still shouldn't be included in this diet. So the autoimmune paleo diet is that plus eliminating all of this. So you can't eat eggs, you can't drink your coffee. Plus you need to cut out all these other vegetables now. You can't eat eggplant, peppers, tomatoes, blah, 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 blah. Because all this is going to lead to inflammation and it's just, not going to be good for you. So unfortunately or fortunately, there's limited evidence on this. People that tell you that they follow this diet in their life, their autoimmune hepatitis went away, unless they were taking out their gluten, I really doubt it. What this does, why you feel better with this, is because people that aren't following this kind of diet or eating these kinds of foods are in the grocery store buying boxed items with ingredient list this long. So you take out all that processed food, you're going to feel better about yourself. You're going to feel better overall. But it's not specifically because you're eliminating all this stuff. Now, I personally don't eliminate this stuff. And taking out these vegetables, that have properties in them that are actually anti-inflammatory, would actually harm you, The other thing is people with liver disease, especially cirrhosis, you can have you could be malnourished. You're not getting the nutrients you need. You're not hungry. You don't feel good. You're not eating. So if you're putting yourself on a restricted diet like this, it's going to probably do worse for you than good. So what I tell people to do, you go to any grocery store. Just take, for instance, Walmart. You walk in, the first thing you see is the fruits and vegetables on the outside. Then you see the meats on the outside. You walk on the outside, on the square, you see your dairy. All in the middle of the stores is your processed food. Everything where they add chemicals and everything else put them in the middle. Those are the aisles you want to avoid. The exception would be the freezer section where they have the frozen vegetables that don't add anything to them. I mean, those are fine too. But in reality, you really don't need to walk in the middle of the aisles. So as far as what you should eat, so the guidelines really say you want half your plate like vegetables, and then a quarter meat or protein and a quarter grains. Some people tell me, well, they hate eating grains, so then I say do half vegetables and half protein. The thing about it is, and I didn't put this on here, but when you eat like straight up sugar or carbs, like even fruit, candy, cake, whatever, your blood sugar is going to spike. And if that's all you eat, it's going to crash a little while later, and then you're hungry again. So now you're going to eat again, and you're going to get in this cycle. People, especially on prednisone, that are trying to avoid gaining weight, it's going to make you want to eat all the time. So what I tell people, especially my diabetics, when you eat anything, you should eat with protein and a fat with your carbohydrates to help your blood sugar stay more steady. So, for example, if you're going to eat an apple, eat it with either string cheese or peanut butter. that may help your blood sugar stay more stable. So some good foods to eat. Any fruits or any vegetables, especially fruits, are okay in moderation. Drink your water. I can't tell you how many people that walk into my office and say, I can't lose weight, I don't know why. What do you drink? I only drink a 12-pack of Mountain Dew a day. Well, I mean, I don't know what else to say. I actually had one patient lose 19 pounds in like 2 months just cutting out their soda pop. That's how much they were drinking. And I mean, they're way overweight, so it's not like an unhealthy amount of weight, but I'm just saying that's how much you can do. Fresh fish, chicken, nuts and seeds are all good. So other random tips. So I know a lot of people need to watch their salt intake, especially with prednisone. So something you can do, there's Mrs. Dash, but if you don't want to pay for that extra Mrs. Dash, you can buy your own seasonings in the store, like pepper, paprika, cumin, put it in a container, mix it up, and you got your spice. Pinterest, I know most of us have access to the internet here. If you search any recipe you want, like pancakes, for example, there's a recipe on there. You can do 2 eggs and a banana and make pancakes. Like, those are the only ingredients. So if you really like something, search online, and then you can find it. Don't skip meals. People that, especially trying to lose weight, etc., try to skip meals because then they're saving their calories and they're going to lose weight faster. But in reality, what happens is by the end of the day, you're so hungry that you overdo it. So even if you're not feeling well, you're nauseated from the Imuron, whatever, even small little meals a day are going to help keep your blood sugar good, and also so you don't feel like you're starving at the end of the day. A good thing to do is keep a journal of what you eat. Sometimes you don't realize how much or how little you're actually eating until you look at the end of the day. I ate what for lunch? I drank how many of these things a day? I mean, that's one way to do it. And then remember, weight gain or weight loss won't happen overnight. So I went over this a little bit earlier, liver cirrhosis, you get malnutrition. They used to say, well, because of the hepatic encephalopathy is where when you have cirrhosis at the end stage, you can start producing ammonia. It makes you confused, and that's why they put you on the lactulose if anyone's on that here. They used to say that you needed to watch your protein because, a byproduct of protein can increase your ammonia level in the blood and cause problems. But because of the fact that cirrhosis patients are a lot of times malnourished, they found that there's no real benefit to limiting protein, and actually it can do more harm when you do limit protein than if you don't. And then ascites is when, the liver's not working well. You start getting all this fluid in your stomach area, and you have to drain it. So a lot of times your doctor will recommend you avoid salt or limit it in your fluid intake. So talk to them about that. So Imuron and Cellcept. One of the most common side effects is nausea and vomiting. I can tell you from personal experience, I definitely had the nausea. So what things you can do? I go ahead, again, talk with your doctor, but what I did, I split my Imuron half in the morning and half at night. For whatever reason, that helped me. The other thing is some people will actually lose weight on this medication, Imuron, even though you're on the prednisone because of this. Some things you can do, again, eat small snacks throughout the day. Nuts are really good for you. They have high calories, string cheese, protein shakes if you have to do it. Prednisone, everybody's favorite drug in the audience. What? Yes, everyone's favorite drug. So weight gain, big appetite, bone loss. So again, eat more protein with your carbohydrates. Try to do as much exercise as you can. I know saying even that word in here is probably not making people too happy. You're like, I have too much, I have no energy. How am I supposed to do exercise? We'll get to that in a minute. But I will say I was on prednisone about 2 years, and this is my foot from last year where I was just running one day and no sign at all. Boom, my foot broke. And it took 6.5 months to heal. And I don't know, is that because of the prednisone? Is that because of the prednisone and my other autoimmune diseases? I don't know. But I just want to say again, as Dr. King said earlier, your calcium and vitamin D supplements, make sure you're getting your dairy products. so that you can try to avoid this. And here we are at exercise. So the American Heart Association recommends that you do 150 minutes a week or 30 minutes, 5 days, and actually strength training. Now, I don't mean like trying to like totally bulk up, but some basic strength training, push-ups, lift canned food in your house, just something to get those muscles up. And those of you that can't do 30 minutes at one time, you can do 5 minutes here, 10 minutes here, as long as you're getting your exercise during the week. You will often find, at least I often found, that you can do something. Hold on. Sometimes you're tired, you feel like you can't do anything at all, but then actually after you do the exercise and get through it, you feel more energy after the fact. So once you can get yourself out the door, you might feel better. And if you can't make these recommendations, at least something is better than nothing, okay? Some people have gyms at work. If you have 5 minutes, run into the gym. That's me in the hospital, and I totally did do that. And you got to find what you like. If you like to run, you like to swim, you like to bike, whatever it is, you got to find it and just do that. Supplements. Here's the other thing on the website I see all the time. I'm going to buy this supplement and it's going to cure my life. No, it's not. You know, if us doctors don't sit in a conference room all day and say, we came up with this great supplement and we're going to hide it from all of our patients because we want a job and we don't want to work. I mean, no, we really don't have anything, you know, that's going to cure autoimmune hepatitis or with a pill. In fact, you know, it can cause more harm than good. Something as simple as melatonin, there have been case reports online that show it has caused some people's autoimmune hepatitis, melatonin, which is used for sleeping. You buy it over the counter. How harmful could it be? What else? The problem is anyone in this audience could leave here today, put whatever they want in a pill, stick it in the grocery store and call it the cure for autoimmune hepatitis, and put whatever ingredients you want on the label. And people are going to start buying it. Well, the thing is, nobody has to screen you to do that. You can do whatever you want. It's a supplement. It's not regulated by the Drug Association in the U.S. So they have actually done studies where they pull supplements off the shelf and test what's in them compared to what's on the label and found they're not even similar. So that's pretty scary. Weight loss supplements are not good supplements to take. They put all kinds of things in there and has been linked to autoimmune hepatitis. One last one, I'll go over 2 more. Liver thistle. I've had mixed reactions on this. I have some, at least GI doctors, that say they'll give it because they don't see any harm from it. I've had others say don't give it because, you know, it may cause more harm than good. There's no evidence it's going to do anything. As far as help you, it may hurt you. Probiotics is another one. So probiotics, and the thing is with probiotics is when you have autoimmune hepatitis, you're on immunosuppressants, so your immune system is not working as well, so you can get infections earlier. If you are taking probiotics, which is still a bacteria, but it's a good bacteria, and your immune system can't handle it, it can actually overpopulate the good bacteria and cause severe infection called sepsis, and cause you to go to the hospital. I'm not going to say it happens to everyone. There's probably people in here taking them. They're fine. But if you look on, I have seen case studies online that do show it. Let me go back to this. So this quote I came across, you know, is from a Philadelphia doctor, a hepatologist actually, that said, you know, there's really no miracle in a bottle. I know we're always all looking for one, but there's really not one. So your lifestyle will affect your overall health. Nobody in here, I don't think, stood up one day and said, I hope I get autoimmune hepatitis one day. So, I mean, nobody did, but what we can do do the best we can with our lifestyle to give us our best chance as far as with that, you know. If you take that out of the picture, meaning you're eating well, you're exercising, then at least we don't have to worry about that as being a part of the problem. So summary is that the research on autoimmune hepatitis is limited. Coffee may help you. Fatty liver is going to harm you, so make sure you try to obtain your ideal body weight and exercise. Gluten only needs to be really eliminated if you have celiac disease or if you have an allergy to it. And sorry, but the autoimmune protocol diet is not really going to help you all that well. Just stick with fresh, whole foods. Watch your sugar and salt intake, exercise, avoid supplements, and at least tell your doctor, what you are taking. Because if we don't know you're taking it, then it's not going to help us. And my final remarks are that no matter, I don't care who has this, and especially for the younger people in the audience, when I was diagnosed with this at the beginning of, before I even started medical school, I was told, I should take a couple years off, wait, or whatever. And I said, no, I'm going to do what I want to do. I don't care. So don't change your dreams because of this disease. You're going to learn to manage it. You have to learn to manage it. But it shouldn't change your outcome, what you want to do. And then, like I said, my Facebook is DMERD. So you can message me, and I'll try to get back to you. And that's it.